to kind of help and try to figure out what the right specialty can be so challenging for any medical student. I think for me, I have nobody in my family who's a physician, so choosing a specialty was really a daunting task when I was in medical school. And I think one of the things that's really challenging about medical education is that during our clinical years, we often get exposed to the life of a resident of any given specialty. So you rotate on surgery or on internal medicine or on OBGYN, and you follow the residents on the service, and you get a really good view of what it means to be a resident on that specialty. And then you rotate in radiology, and frankly, it's kind of boring when you're a medical student. It's very passive often, and you're kind of sitting in the background watching other people read cases. But what you don't realize is that you have the potential to change people's lives based on the analysis of an image. And you don't realize how much power you have to help direct a patient's care. And so I'm reminded of a case that we just recently saw of a 20-year-old guy who came into our hospital with what sounded like it could be a cancer. Everybody was kind of teeing him up for, could this be a lung cancer? But based on our experience in practice, we saw that they had these little areas that were these lower attenuating or lower colored areas in the center of these masses. And this is really typical of a fungal infection called histoplasmosis. And our team was the first to suggest that this was the diagnosis, which eventually was what this 20-year-old found out that he had. And you can just imagine how it changed his outcome, the approach to his care, what it did for his family. And I'm proud to say that it was our team that played that role in making that diagnosis. And so for medical students who are thinking about radiology, a few things to kind of take out of the back of your mind. The first is you don't like medicine, and therefore you go into radiology because it allows you to kind of escape from clinical medicine. Quite the contrary, I find that the most successful radiologists are those who actually enjoyed clinical medicine so much that they couldn't figure out which area they wanted to go into. And the benefit of a specialty like radiology is you have to learn to be able to speak to the experts in all the specialties in order to make a difference. And then when I was an undergrad, I went to college where they had a requirement that we had to take classes in various disciplines. And to meet one of my requirements, I took an art history class. To my surprise, I really enjoyed the art history class a lot. And I was really shocked to tell you, not now, but at that time I would have been shocked to tell you, that art history was probably the closest to radiology that I got as an undergrad, because that ability to look at a painting and to be able to break the painting apart and figure out what brushstrokes would suggest what artist had created this work is actually very similar to our analysis of an image. And so if you're creative and if you're visually oriented, and if you find that you enjoy working with teams and you really enjoy clinical medicine, radiology is a great specialty because it allows you to function in that team and use your visual acumen to make a difference for patient care.